Thank you for having me here. I'm so excited and honored to be part of the Medicine X conference this year. And I'm excited to be talking about one of my favorite topics, community organizing, with a group of people who so deeply value and embody community. I'm also excited to be talking about this right now because there is a lot of work to be done in the healthcare advocacy space. And I know that the folks in this room are doing tremendous work, and so I'm excited to share some lessons learned from my experiences. So I cut my teeth doing political organizing on campaigns. I worked on President Obama's campaigns in 2008 and 2012, where I really got to see organizing up close at a granular level, mobilizing people block by block and city by city to take action together for the same cause. After that, I was fortunate enough to go work at the U.S. Department of Health and Human Services. Emily and I discovered backstage. We basically worked in the same office, just a few years apart. But I was there in 2009, 10, and 11, working to help pass the ACA, and then serving as a liaison to governors and mayors as we worked together to implement the law. And now I work at 270 Strategies. We're a public engagement consulting firm, and we help organizations devise their own grassroots advocacy campaigns. We've worked with a number of healthcare advocacy organizations like Enroll America, Partners in Health, Planned Parenthood, Autism Speaks. And so through my various experiences in organizing, I've learned that there are three key elements to devising your own strategy for a grassroots campaign. First, you have to identify who your audience is. Second, you have to define the message that's going to move that audience. And third, you have to determine your tactics and your structure to get people to take action. So how do you know who your audience is? Well, first you need to start by determining who your targets are. Who are the deciders? Who has the authority to determine the outcome on the issue that you care about? Is it Congress? Is it a state legislature? Is it a federal agency in the executive branch or a local regulatory board? And who in that body is undecided? Who's persuadable? Who can be convinced to come over and join your cause? Stepping back from there, who are the individual voices that are most likely to persuade those targets? Who will move them? Who will they listen to? Those messengers are your audience. These are the people you need to talk to, the people you need to convince to join you. And it's going to probably be the constituents of the elected officials we were just talking about. But we can be a little bit more specific than this. There are a number of categories, but I can think of four groups that you should really go after there. First are individuals who have a good story to tell because they have a personal connection to your issue. Storytelling is so important in organizing, but we'll come back to that in a second. Second, you want to find people who are supporters of these elected officials you're targeting, people who have donated to their campaigns, people who have volunteered for them, people who have publicly endorsed them. Your targets are going to want to keep those people in their camp, and they're going to listen to what they have to say. Third, you want to use the element of surprise. Are there unexpected voices that people would not assume to be part of your coalition? If you're working on an issue that is primarily supported by Democrats, find Republicans that want to join your cause. Make them a central point. Their voices are going to make a bigger splash. And fourth, find people who are already influencers in their communities. Pastors, teachers and principals, leaders of business associations and neighborhood associations, local elected officials. People have louder voices because of the people they're known to represent. And there's a good chance they can bring those people along with them to join you. So now that you know who you're talking to, you have to figure out what you're going to say to them. How do you craft a message? You want to think through who your audience really is, what motivates them, what appeals to their hopes, what appeals to their fears. Both are powerful motivators. But the most important thing is that it feels authentic and it rings true. And so there are three considerations in crafting your message. First, remember that emotion will always trump statistics and trump facts. I'm not talking about, ignoring facts or, God forbid, engaging in fake news. But start with a story and use statistics really sparingly. When President Obama was pushing for the passage of the Affordable Care Act, he would frequently tell the story of a woman named Natoma Canfield. Now, Natoma had written to the president because her insurance company raised her premiums year over year over a year because she'd been diagnosed with cancer. And eventually she could no longer afford her premiums and lost her insurance. And at this point, she's worried that if she gets sick again, she's going to lose her house too. The house that her parents, her mother and father, built themselves. The house that she'd lived in her entire life. Now, when the president was stumping for the ACA, he would cite the fact that we had a nearly 20% uninsured rate in this country, and he would use facts about what his plan would do. But he would start and end by talking about Natoma. Facts weren't moving people, but Natoma's story did. And we saw that this summer, too, when Congress went into recess and legislators all over the country went home to their districts and held town halls. They were confronted by individuals whose lives had personally been saved by the ACA, or whose children's lives had been saved. Those stories were powerful, and it spooked legislators who were thinking about voting for repeal. The next thing you should think about in crafting a message is that you want to start locally and then build it out globally. Marshall Gans is a renowned professor at Harvard and a longtime leader in community organizing, and he talks about this in terms of story of self, story of us, story of now. So you start by talking about your personal narrative. Why do you do this work? What issues and experiences in your life brought you to this? Why does it move you? But not just you. Why does it move people around you? Why does this matter to your community? Why would it matter to someone at your church or your school, in your city, in your state? Why is it bigger than just you? And then why does it matter now? Why do we care about this? Why are we talking about this right now? What would happen if we didn't act? If we did nothing for weeks or months or years? What would be the outcome? Which brings me to the last point to consider in crafting your message. Keep it very simple and keep it focused on outcomes. There's a good rule of thumb that if you're explaining, you're already losing. If you have to get down in the weeds and facts and figures or talk about healthcare financing, everyone's eyes will glaze over. You want to keep it very simple, and you want your message to explain what the experience will be for a real person under the public policy that you're advocating. So a good example of this right now is you may have noticed that advocates of a single-payer healthcare system have started more and more talking about it as Medicare for all, which is a much better frame for that policy. Single-payer is focused on how we finance healthcare. I mean, again, healthcare financing, people's eyes glaze over. But it says nothing about what the policy would do for the user. Medicare for All relies on the familiarity of Medicare and also the popularity of the program. Everyone knows somebody who has Medicare coverage. Everyone can visualize what it would like to have Medicare coverage yourself. And it's a very popular program, totally across the political spectrum. I mean, if you go to Tea Party rallies, you will sometimes see people holding signs that say, "Keep your government hands off my Medicare." So we know that it's got a following. So now that you know who you're talking to and what you're saying to them, you want to think through what are the tactics that move people to action? How do I ask them to do that? And what's the structure that I need to build a successful program? If you were doing your job well, you're bringing all kinds of new people into your movement, people who probably have not been involved in advocacy or political activity ever before. And this may be intimidating to them. You need to meet your supporters and volunteers where they are now and help move them to take the action you ultimately want them to take. We call this moving people up the ladder of engagement. Start by asking them something very simple, asking them to sign an online petition or retweet a tweet. Next, you ask for something slightly bigger. You might ask them to call their member of Congress, but provide them a script so they feel comfortable with what they say, or sign their name to a letter to the editor that you've already drafted. And then you ask for bigger involvement. You ask them to attend a rally and bring a friend with them so they have a buddy system. Or you ask them to make a small dollar donation or to join a phone bank to recruit other volunteers to help the cause. The most important thing is that you always make an ask. Anytime you're communicating with people that could be members of your movement, whether you're emailing or having conversations, never pass up the opportunity to make an ask. It might feel invasive, it might feel like you're wearing out your welcome if you ask for something every time. But those asks are what make people feel engaged in the movement. It reminds them that it's important, it reminds them that they're needed. So never miss an opportunity to make an ask. And it also requires that you keep good data and good lists of the people that are your supporters that you're working with. You need to know who's worked for you in the past, what they've done, and what action you're going to ask them to take next. If you don't have a CRM or a system to track people, then just keep a spreadsheet. You're also going to need a structure for this organization that you're building. You as one person or whoever's leading this movement can't talk to all the individuals that are involved. You want a pyramid-shaped structure with a leader who's managing regional leaders, who manage local leaders, who manage teams of volunteers. We used a very similar structure on the Obama campaign, and we discovered that the magic number was 7 for management ratios. An individual in your pyramid can manage about 7 people in the layer below them before they get overwhelmed. So keep that in mind. One last point that I'll share before we close. There's a lot of work to be done at the federal level on healthcare policy right now, obviously. Some of that will probably be on defense rather than offense. But if you have an interesting idea or a new innovative solution for public health, be sure to look around you at the state and local level. States and cities are by far the best incubators for new, innovative public policy. And I know there are a lot of great ideas in this room. It's also a much less daunting place to start an advocacy campaign. If you have a good idea and you can prove it at the local level, it will spread. And city council members and state legislators just don't receive the volume of incoming input that a member of Congress does. So if you can generate, a small rally or 100 or 200 phone calls into a state legislator's office, that's going to have a dramatic impact. As I looked at this agenda for this weekend, I was really excited and heartened to see the breadth and the depth of leaders in the healthcare space, and I'm just so excited to have a chance to talk to more of you this weekend and answer some questions on the panel and talk more about the tactics we discussed here today. But I want to just close by saying thank you for the work that you're doing. The fact that everybody's coming together and even talking about these issues gives me so much hope for healthcare in the world. Thank you.